Hello, everyone. My name is Sheena Skelton. I am the registered dietitian at our local food bank here in Las Vegas, a 3 Square Food Bank, where I get the privilege of being able to focus on all things really health and nutrition at our food bank. I like to explain my role really as wearing like 2 different hats. I do work in the program management side as far as owning my own program, specifically with senior congregate meals, as well as the nutrition education space. And then I also like to tease that I get to have my hands in everybody else's business with really more consulting, for lack of a better term, of looking at all the programs that we have at the food bank and nutrition initiatives, and really getting a say to work with different managers on that nutrition piece of each of the different programs. A little bit about what we're going to talk about today, touch on food insecurity, really look at what's going on in Nevada specifically, food insecurity with the aging population, as this is more of the focus of my discussion today, really focusing on the programs at our food bank that focus on that population. And hopefully you get to know us a little bit more as far as what we do here as a food bank. I know Dr. Lindsay and I actually talked about potentially having a tour at the food bank. It just didn't quite work out in the schedule. So I figured we'd bring the food bank to you and we'd look at some photos and just kind of highlight some of our spaces and some of the work that we do. So the good news is I don't have to spend a lot of time on this slide because Dr. Nguyen and Dr. Buffington did a wonderful job, very eloquently put, as far as all of these definitions for hunger, food insecurity, nutrition insecurity. What I will touch on, though, is that really with our network of food banks, we're actually a part of the Feeding America Network. If you're not familiar with that organization, it is a national hunger relief organization comprised of about 200 food banks. There has been such a push, which is really refreshing, right, to look at nutrition insecurity. A lot of the reason why I have a job at the food bank, we're seeing more and more dietitians at food banks as well in this space. So not looking at just the quantity of food that we're pushing out to the community, but looking at that quality of food as well. Okay, so jumping right into what's going on here in Nevada, if I can draw your attention to the map on there, if you weren't familiar, we actually only have 2 food banks in this state. I know Dr. Lindsay pointed out, we have the issue of being very rural, but also very urban. Here in Southern Nevada, we really have more of the urban issue and having more of the mouths to feed, if you will. So that also equates to the fact that we have 97% of the food insecure population, whereas Food Bank of Northern Nevada, which is, you can guess, in the north, they focus a lot more on the rural populations because it's kind of the opposite problem. We do service 4 counties, as you can see there, Lincoln, Nye, Esmeralda, and as well as here in Clark County. So it's not that we don't assist with rural initiatives, just again, very urban, more people that reside here in the South. When we look at the numbers for 2022 to 23, for Southern Nevadans, there's about 274,000 individuals that are experiencing food insecurity. That equates to 1 in 8 individuals. And then when we look at those numbers specifically for children living in food insecure households, that's 94,000 children, or 1 in 6. Okay, so jumping into the aging population, the most recent numbers that I pulled here are actually all from Feeding America. The most recent is 2020 data. So when we look at seniors specifically, and they define seniors as 60 plus and older adults as 50 through 59, we have a little over 9 million individuals across the US that are experiencing food insecurity, or seniors. When we put those two age brackets together and we look at Nevada specifically, you're looking now at 79,000 individuals, seniors that are experiencing food insecurity, or 1 in 10. So quite a large number there. I would be remiss if I didn't touch a little bit, obviously, on food insecurity and mental illness and mental health. I am the first to say I am not a mental health expert by any means. I know we talked about taking a friend with you to lead on that path. So if any mental health professionals want to take me with you, I'm with you. Please come grab me, and I will just drag me along. But I wanted to really touch a little bit on, obviously, with seniors. Looking at a 2020 meta-analysis, really talked about food insecurity contributing to those elevated rates of depression as well as stress in seniors. And especially when you compare senior numbers to the younger population, you tend to see a lot higher rates with that age group. I also wanted to briefly touch on loneliness. As probably a lot of you in this room know, loneliness very, very prevalent, especially within this population, especially with social isolation. I'm making up words today. Isolation. There is a strong association when it comes to loneliness and food insecurity as well. Okay, so I'm going to jump back a little bit, and hopefully you can get to know us as a food bank a little bit more. Our mission, hopefully it's no surprise to anybody what a food bank does, is we want to provide wholesome food to hungry people while passionately pursuing a hunger-free community. As I mentioned, we're the only food bank here in Southern Nevada. We're also the largest hunger relief organization. We also are the babies of the Feeding America Network. We were actually established in 2007, so I think we're coming up on Sweet 16 here, but we do have over 180 community partners, and you can think of them more in the term of food pantries. I know that term tends to get interchanged with banks versus pantries, but that's what the 180 really stands for. That do help us to push out lots of food out to the community. So just 22 to 2023, we're looking at 36 million meals that were distributed out there. 1 million of those specifically to low-income children and 3 million to our seniors. And those numbers come specifically from the programs that we run here at the food bank. And of course, we can't do anything that we do without the wonderful help from our community with volunteers that have donated over 44,000 hours of service to help us get food out the door. Okay, so this is where my little picture tour comes in. Just to kind of give you an idea of where we're at, we're actually on the northeast side of town, actually quite a distance from here. We are spread out across 3 different campuses. So the north and south campus that you see there are the original buildings, the one that's probably the community's most familiar with. However, in 2020, we did open up a 3rd location at the east campus, also known as our senior hunger campus, where I'm sure you could guess we get to focus more on food insecurity for the senior population. Another picture of our beautiful lobby at the North Campus, the one the community tends to be most familiar with because a lot of our volunteers come in and out of that location. And then I also wanted to point out just our warehouse spaces. This is a picture of our North warehouse specifically, but we do have warehouses at every single campus location with the dry storage space, refrigeration, freezer that equate to about 152,000 square feet of space to store food. And then lastly, I wanted to highlight 2 more spaces that are fairly unique to food banks. And again, you don't see them too many across the entire Feeding America network. But the first one is our 3 Square Kitchen. It is a very massive commercial kitchen. The risk of sounding a little braggy, it is pretty on par with a lot of the casino kitchens that you see here on the strip. And you see actually Chef Joe is our executive chef that's preparing meals. We do make all of our own food for the federal feeding programs for children, as well as for our senior congregate meals. So I get to work very closely with him with all those menus, which is a lot of fun. And then the other picture I wanted to show is our 3 Square Center. And you're like, Sheena, why are you showing me pictures of cubicles? I've seen cubicles before. Thanks. We like to think so. It's of course the work that it gets done in the 3 Square Center. It's essentially a call center. It's a team of about 10 advocates. It's also known as our benefit services outreach team. So anyone from the community can call in. And I will also say that these advocates are also out into the community as well at different events, but they really focus on not just connecting the food assistance piece, so what pantries can we go to, but also all of the wraparound services, so think SNAP, energy assistance, and I'll have a laundry list of those later on in the presentation. Okay, so very briefly, if you're not familiar with how a food bank works, here's your infographic for you. And I like to think of the brown text is more the traditional food bank model that everybody is familiar with. When we're talking about bringing in food and funds that are donated and storing those foods, and we also receive things from federal programming as well. We have a massive logistics operations that get everything to the food bank itself, where we can sort, then distribute. That's where our volunteers come in. and then we get them out to our program partners who are really responsible for that direct service to all of our community members. The items in orange, really what I like to call, well, not what I call, it's the name of our department, is strategic initiatives. And we kind of work more in the community programming space. And of course, those wraparound services. So our 3 Square Center is a part of that. I fall under this umbrella where we get to focus on all of the programs that you see listed there. Again, really more focused on seniors and children for those more vulnerable populations. We also have nutrition education, as I kind of mentioned. I will say I'm taking this next year to actually kind of revamp the program. And then we also have operations where we do food rescue to be able to rescue from grocery stores, retail stores, the casinos that we have out here to then be able to give out to the community. But today I'm going to focus more on our senior programming as well as healthcare partnerships, as that really has touched, as far as like the referrals are concerned. A lot of the referrals that we are seeing are from our seniors in the community. Okay, so jumping into our senior hunger programs, our flagship program is our Golden Groceries program, where we serve about 10 to 11,000 seniors a month. And it is a client choice model pantry program. We have about 30 locations across Southern Nevada. And it is a supplemental grocery program. The only qualification is you have to be 60 and better, as we like to say. And I get to work with this program manager, really focusing on the inventory. It's pretty static for the types of foods that we do serve. Everything is heart healthy, it's diabetes friendly. We're able to provide fresh produce, fresh bread, lean proteins, a variety of shelf-stable type items to include Ensure. And then this past year, we also just piloted a program with one of our partners where we're now starting to add ready-to-eat meals with that, which is essentially frozen meals that are all prepared by our kitchen, which is really awesome. So hopefully that goes well and we can start adding that to all of our partners. The other thing I'll mention as well is that we also integrate nutrition education into this. So we've created nutrition guides for the food, some food navigation cards to help individuals choose food. And actually we did, at least with the guides itself, was in partnership with here at the extension, where they helped us get some of those materials printed and out the door, which is really awesome. More on our senior hunger program, we have our Golden Groceries on the Go, which was really born out of the pandemic. Obviously a very vulnerable population. Certainly didn't want those individuals out in the general public because we don't want people to get sick. So we offered curbside pickup with a lot of our partners. The other piece that's been really key is home delivery, because I know we have a lot of homebound seniors. So we're able to do that through, I think we have about 5 partners that assist us in the actual delivery of food boxes to our seniors. And then we've also partnered with DoorDash through their nonprofit arm, Project Dash. So they actually are able to pick up from those partners, and also they're here at the food bank to then get those the food out to the seniors. We've also paired transportation assistance. As you know, transportation tends to be a barrier for food. And we've done this through really awesome partnerships with RTC, our Regional Transport Commission. So we can offer 2 24-hour bus passes a month to seniors. And then also with our amazing partnership with Lyft, which requires no technology on the seniors' behalf, which is really cool because our 3 Square Center can really set all of that stuff up for seniors. And so that's 5 free rides per month, and they can go to a Golden Groceries pantry. They can go to any kind of store that accepts SNAP benefits if they're on that. They can also get their COVID vaccine appointments, and then also 2 senior congregate meals of their choosing. Doesn't have to be the hours, but any that are in the area that they want to choose. Moving on to our senior congregate meals. This has been my baby since like last year, as far as we have an amazing partnership with the Las Vegas Library District. This is, as you can guess, free hot nutritious meals for seniors, and that includes their loved ones. So if they show up with their family, if they're with their friends, we'll feed everybody in that party, which is really awesome. As I mentioned, we're partnered with the library, and it's for a lunchtime meal, and they've been so generous to let us use their spaces. They also assist us with a lot of the activities and education as well. We operate right now out of 3 different locations, but we're able to serve a meal at least 5 days a week, which is really cool. And the other part that I definitely want to mention is we understand that it's also just obviously not about food, right? There's a huge socialization piece that does come with eating in this congregant style and being able to bring your family. We've certainly seen a lot of new friendships that have been made. We have a lot of regulars that come and they just come to hang out with their friends, which is really cool. So they bring their families. We've even seen budding romances, which is super cute. But with the activities and education, we do everything from board games to we've done nutrition education classes, we do movies, you name it. We've probably tried something in that space to see what seniors actually enjoy. One more program that I'd like to quickly touch on is our healthcare partnerships. I know we've kind of heard a little bit about obviously that the tie between food insecurity and as far as health outcomes are concerned. So with this program, pretty in line with, I'm sure a lot of you are already familiar with the food as medicine movement, but very similar as far as what we're doing in our spaces as well. So, you know, taking what we see, or at least healthcare providers, and partnering with them for what they see in the clinical spaces and that impact on health that food insecurity could be having on their patients, and how do we bridge that gap with all of the local resources. So that's kind of where we come in as the food bank to help connect those patients to resources. Our program is very referral based right now. So the name of our program is actually Screen and Intervene. So the processes that you see there on the slide, step one is how do we help these organizations set up screening processes to identify those individuals who are food insecure. We do utilize the hunger vital signs. I actually don't have a slide on that, but if you want to come find me and we can talk more about that if you'd like, but 2-question screener to quickly identify who those patients are. And then, you know, a lot of times we, as healthcare providers, we know like we have to refer, but we don't know who to refer to, right? So again, that's where we come in. The patient is then referred over to the 3-Square Center, where they're able to then directly contact that patient and then start the screening process with looking at what types of food assistance that individual needs, and then all of our other wraparound services, which I'll show on the next slide. And it's also certainly not a one and done for us. We have a process of where we follow up with each patient. So it's, you know, we call a couple of days later. Did you get to the food pantry? Did you get your ride? What other processes or documents that do we need to finish up your paperwork for some of these applications? So they have a warm hand to kind of help them through the process and make sure they do get connected. Because the ultimate goal here, right, is to, you know, increase their nutrition, hopefully decrease medical stays, you know, look at a cost savings that certainly is very helpful for the situation. So they don't have to make those decisions of, am I going to spend my money on food or am I going to spend it on medications? The other thing I'll mention is that we are looking to expand more in this space to include more nutrition initiatives associated with that. So things like on-site food pantries, medically tailored meals or food boxes, education, all of that. Okay, and as promised, here's a list of all the services that our 3-Square Center also provides. Mentioned all of the food assistance pieces there to include SNAP, energy assistance, Project Reach, which here in the state of Nevada is a form of energy assistance specifically for seniors. They can also help with applications for different portions of health insurance, and then other assistance is needed. We talked about transportation, education, and then of course, with using our partnerships within the community, if it's something that's without or out of our scope, then we can connect those individuals so they can get other assistance as needed. And one other item I'll mention on the slide is that with our partnership with, we have a strong partnership with the state. So we are a trusted agent to pretty much do everything from start to finish with these applications. So everything from the interviews, the signatures, just short of actual approval of this kind of stuff. So it does help the state and get things kind of moving a little bit faster to get people the help that they need. And I will reserve questions for after, but come find me if you have any. And thank you so much for your time and having me.